certain commonly prescribed medications can elevate the risk of dementia in senior patients. Anticholinergic effects in some drugs can impair cognitive functions, increasing dementia susceptibility. Sedative medications can lead to drowsiness and reduced mental alertness, potentially accelerating cognitive decline. The cumulative effect of these medications over time can significantly impact long-term cognitive health. Regular medication reviews are crucial for seniors to minimize potential cognitive side effects. Alternative non-pharmacological interventions may help reduce reliance on high-risk medications. Anticholinergic drugs function by blocking the action of acetylcholine. Acetylcholine is a neurotransmitter crucial for memory and learning processes. By blocking acetylcholine, anticholinergics can affect cognitive functions. The mechanism of anticholinergics involves competitive inhibition at acetylcholine receptors. This blockage disrupts normal neurotransmission, influencing various bodily functions. Anticholinergic effects can manifest differently depending on the specific drug and dosage. Anticholinergic drugs function by blocking the neurotransmitter acetylcholine. The blockage of acetylcholine impairs nerve signal transmission in the brain. Impaired nerve signal transmission can lead to cognitive decline. The mechanism involves the competitive binding of anticholinergics to acetylcholine receptors. By disrupting cholinergic neurotransmission, these drugs can negatively affect memory and learning processes. Sedatives, such as benzodiazepines, can suppress brain activity. Suppressed brain activity can lead to confusion. Sedatives can also cause memory problems. The suppression of brain activity by sedatives directly impacts cognitive functions. The effects of sedatives on the brain can be particularly detrimental for individuals with dementia. Benzodiazepines increase the effect of GABA, an inhibitory neurotransmitter. GABA reduces neuronal excitability throughout the nervous system. Benzodiazepines slow down brain function by enhancing GABA's inhibitory action. This enhancement leads to a calming effect, reducing anxiety and inducing relaxation. First-generation antihistamines readily cross the blood-brain barrier. Crossing the blood-brain barrier leads to significant anticholinergic effects. Anticholinergic effects result from the blockade of acetylcholine receptors. Common anticholinergic effects include drowsiness, dry mouth, and blurred vision. The ability to cross the blood-brain barrier distinguishes first-generation from second-generation antihistamines. Anticholinergic effects can impact cognitive and physical functions. Diphenhydramine, commonly known as Benadryl, is a typical antihistamine. Diphenhydramine possesses strong anticholinergic properties. Due to its anticholinergic effects, diphenhydramine should be used cautiously in elderly individuals. Caution is advised due to potential adverse effects associated with anticholinergic drugs in seniors. Non-sedating antihistamines such as loratadine and cetirizine can be considered as alternatives to diphenhydramine. Loratadine and cetirizine offer antihistamine effects without causing significant drowsiness. Diphenhydramine's sedative effects can impair cognitive function and physical coordination. Non-sedating antihistamines provide allergy relief while maintaining alertness and productivity. Choosing the right antihistamine depends on individual needs and potential side effects. Consulting a healthcare professional is recommended to determine the most suitable antihistamine. Tricyclic antidepressants possess strong anticholinergic properties. Anticholinergic properties of tricyclic antidepressants can affect cognitive function. The strong anticholinergic effects of tricyclic antidepressants can cause cognitive impairment. Tricyclic antidepressants' anticholinergic activity impacts neurotransmitter activity. Amitriptyline, a tricyclic antidepressant, is associated with an increased risk of dementia. The increased dementia risk is linked to amitriptyline's anticholinergic effects. Anticholinergic effects disrupt normal brain function, potentially accelerating cognitive decline. Long-term exposure to drugs with anticholinergic properties may contribute to the development of dementia. Alternative treatments with fewer anticholinergic side effects should be considered for patients at risk of dementia. Careful medication management is crucial to minimize the risk of cognitive impairment in vulnerable populations. Selective serotonin reuptake inhibitors, SSRIs, are antidepressant alternatives. SSRIs may present safer antidepressant options compared to other medications. SSRIs exhibit fewer anticholinergic effects. The reduced anticholinergic properties of SSRIs contribute to their potentially improved safety profile. Antipsychotic medications, particularly first-generation types, may lead to cognitive impairment. First-generation antipsychotics are more likely to cause cognitive decline compared to newer medications. Cognitive impairment from antipsychotics can manifest as memory loss, reduced attention span, and difficulty in problem solving. The risk of cognitive decline should be carefully considered when prescribing antipsychotic medications. Haloperidol, a first-generation antipsychotic, presents a high risk of cognitive side effects. Due to its potential for cognitive impairment, haloperidol should be administered with caution. The cognitive risks associated with haloperidol necessitate careful monitoring of patients. Alternative antipsychotics with fewer cognitive side effects may be considered. Regular cognitive assessments are crucial when using haloperidol to detect early signs of impairment. Atypical antipsychotics may present a marginally reduced risk of cognitive impairment. Second-generation antipsychotics are associated with a potentially lower incidence of cognitive side effects compared to first-generation options. The cognitive impact of atypical antipsychotics is a key factor in medication selection. The comparative cognitive profiles of antipsychotic medications inform clinical decision-making. Atypical antipsychotics represent a potential advantage in preserving cognitive function. Certain bladder control medications possess anticholinergic effects. Anticholinergic effects from these medications can negatively impact cognitive function. Cognitive functions such as memory and attention may be impaired by anticholinergic drugs. The impact on cognitive function is a potential side effect of bladder control medications with anticholinergic properties. Oxybutynin is a medication prescribed for the treatment of overactive bladder. Oxybutynin's anticholinergic properties can lead to cognitive side effects. Anticholinergic effects impact neurotransmitter activity in the brain. Cognitive side effects may include memory impairment and confusion. Patients should discuss potential cognitive risks with their healthcare provider. Alternative treatments for overactive bladder may have fewer cognitive side effects. Non-pharmacological treatments, such as bladder training, can be considered as an alternative to medication. Bladder training involves scheduled voiding to gradually increase the interval between bathroom visits. Newer medications with fewer anticholinergic effects are also an option. Anticholinergic effects can include dry mouth, constipation, and blurred vision. Consultation with a healthcare provider is essential to determine the most appropriate treatment strategy. Certain medications prescribed for Parkinson's disease may induce cognitive side effects. Confusion is a potential adverse reaction to specific Parkinson's disease treatments. Hallucinations can occur as a side effect of some Parkinson's disease medications. The risk of these side effects varies depending on the specific medication and individual patient factors. Careful monitoring and dosage adjustments are essential to manage these medication-related complications. Benztropine is used to treat symptoms of Parkinson's disease. Benztropine exhibits anticholinergic effects. Anticholinergic effects of benztropine can worsen cognitive function. Patients using benztropine should be monitored for cognitive side effects. Alternative treatments for Parkinson's disease may be considered to mitigate cognitive risks. Optimizing medication dosages for Parkinson's requires collaboration with a neurologist. A neurologist can fine-tune medication regimens to manage Parkinson's symptoms effectively. Careful dosage adjustments can help minimize cognitive side effects associated with Parkinson's medications. Regular monitoring and adjustments are crucial for maintaining optimal therapeutic benefits. Personalized treatment plans address individual responses and potential side effects. Neurological expertise ensures that medication adjustments are safe and effective. Sleeping pills, particularly benzodiazepines, can disrupt natural sleep cycles. Benzodiazepines may impair cognitive function, affecting memory and reasoning. Disrupted sleep cycles and impaired cognitive function are potential risks associated with sleeping pill use. Long-term use of sleeping pills may exacerbate cognitive decline. Consulting healthcare professionals is crucial for managing sleep disorders and minimizing potential risks. Zolpidem, commonly known as Ambien, is a widely prescribed medication for inducing sleep. A potential side effect of zolpidem use is the onset of confusion, especially in elderly patients. Zolpidem can also lead to memory loss, impacting the ability to recall recent events. Long-term use of zolpidem is associated with an increased risk of developing dementia. Improving sleep hygiene involves establishing regular sleep schedules to regulate the body's natural circadian rhythm. A comfortable sleep environment is essential for promoting restful sleep and minimizing disruptions. Avoiding caffeine before bed helps prevent sleep disturbances and promotes deeper, more restorative sleep. Consistent sleep hygiene practices contribute to overall health and well-being by optimizing sleep quality. Opioid pain medications can induce cognitive impairment. Confusion is a common cognitive side effect of opioid pain medication. Drowsiness is another cognitive side effect associated with opioid pain medications. Cognitive impairment includes reduced alertness and impaired decision-making abilities. The severity of cognitive effects can vary depending on the dosage and individual sensitivity to opioids. Patients should be aware of potential cognitive side effects when taking opioid pain medications. Long-term opioid use is associated with cognitive decline. Opioid usage over extended periods increases the risk of developing dementia. Cognitive functions such as memory and reasoning can be impaired by prolonged opioid exposure. The correlation between opioid use and cognitive decline is a significant concern in long-term pain management. Reduced neuroplasticity and synaptic connections are observed in individuals with chronic opioid use. Opioid-induced neuroinflammation may contribute to the development of cognitive impairments. Non-opioid pain management offers alternative strategies for alleviating discomfort. Physical therapy can be an effective non-opioid approach to pain relief through targeted exercises and rehabilitation. Acupuncture provides a non-opioid option by stimulating specific points on the body to modulate pain signals. Non-steroidal anti-inflammatory drugs, NSAIDs, represent a pharmacological non-opioid strategy to reduce inflammation and pain. Selecting non-opioid pain management options should be considered when appropriate for individual patient needs and conditions. Muscle relaxants can induce sedative effects. Muscle relaxants can induce anticholinergic effects. Sedative and anticholinergic effects of muscle relaxants may impair cognitive function. Impaired cognitive function includes decreased alertness. Impaired cognitive function includes memory deficits. Impaired cognitive function includes slowed reaction time. Cyclobenzaprine, a muscle relaxant, carries the risk of causing confusion. Cognitive impairment is a potential side effect associated with cyclobenzaprine use. The risk of confusion and cognitive impairment from cyclobenzaprine is elevated in elderly individuals. Seniors should exercise caution when using cyclobenzaprine due to the increased risk of adverse cognitive effects. Physical therapy can be an effective alternative to medication for muscle relaxation. Stretching promotes muscle relaxation by increasing flexibility and reducing tension. Massage therapy can alleviate muscle soreness and promote relaxation through manual manipulation. These alternative methods offer non-pharmacological approaches to muscle relaxation. Choosing physical therapy, stretching, or massage can reduce reliance on medications for muscle relief. Certain heart medications can indirectly influence brain health and cognitive functions. The effects of heart medications on the brain are often secondary or indirect. These medications primarily target cardiovascular functions, but may have associated neurological consequences. Understanding these indirect effects is crucial for comprehensive patient care and medication management. Digoxin is a medication used in the treatment of certain heart conditions. Elevated doses of digoxin can lead to confusion and cognitive changes. Cognitive changes induced by digoxin toxicity may manifest as disorientation or memory impairment. Careful monitoring of digoxin levels is essential to avoid adverse cognitive effects. Regular monitoring of medication levels helps minimize potential cognitive side effects from heart medications. Kidney function should be regularly assessed to prevent accumulation of heart medications that could lead to cognitive impairment. Monitoring ensures that medication dosages are adjusted to maintain therapeutic levels while minimizing the risk of adverse effects. Cognitive side effects can manifest as memory loss, confusion, or difficulty concentrating. Consistent monitoring allows for timely intervention and adjustments to medication regimens, preserving cognitive health. Proton pump inhibitors, PPIs, can affect the absorption of vitamin B12 with extended use. Vitamin B12 is essential for maintaining optimal brain health and neurological function. Reduced vitamin B12 absorption may lead to neurological complications. Long-term PPI usage requires monitoring of vitamin B12 levels to prevent deficiency. Supplementation can counteract the effects of PPIs on vitamin B12 absorption. Vitamin 12 deficiency can lead to cognitive impairment. Low levels of vitamin B12 are associated with an increased risk of dementia. Maintaining adequate vitamin B12 levels is crucial for cognitive health. Cognitive impairment and dementia risk are significant consequences of vitamin B12 deficiency. Regular monitoring of vitamin B12 levels is crucial, particularly with prolonged use of proton pump inhibitors, PPIs. Long-term PPI usage can impair vitamin B12 absorption, potentially leading to deficiency. Vitamin B12 deficiency can result in various health issues if left unaddressed. Consider vitamin B12 supplementation to mitigate the risk of deficiency associated with long-term PPI therapy. Seniors should have their medication lists reviewed regularly. Regular medication reviews are conducted by a healthcare provider. Medication review ensures accuracy and reduces potential adverse effects. Updated medication lists improve patient safety and treatment effectiveness. Healthcare providers assess medication interactions and contraindications during reviews. Regular reviews optimize medication regimens for senior patients. The primary focus is on identifying medications with anticholinergic effects. Another key area of focus is identifying medications with sedative effects. Minimizing the use of medications with anticholinergic effects is crucial. Minimizing the use of medications with sedative effects is also essential. Identifying high-risk medications involves assessing both anticholinergic and sedative properties. The goal is to reduce potential adverse effects associated with these medications. Deprescribing is the process of reducing or stopping medications that are no longer needed. Deprescribing aims to minimize harm caused by unnecessary medications. The deprescribing process involves careful evaluation and monitoring. Medications are deprescribed when their benefits no longer outweigh the risks. Deprescribing should be done under the guidance of a healthcare professional. Consultation with a healthcare provider is essential before altering medication regimens. Healthcare providers offer expertise in medication management and potential side effects. Altering medication without professional advice can lead to adverse health outcomes. A healthcare provider can assess individual health conditions and medication interactions. Professional medical consultation ensures safe and effective medication use. Non-pharmacological interventions should be prioritized whenever feasible. Lifestyle adjustments represent a key category of non-pharmacological interventions. Therapies also constitute a significant aspect of non-pharmacological interventions. Prioritizing non-pharmacological approaches can reduce reliance on medication. Non-pharmacological interventions often promote long-term wellness and improved quality of life. These interventions empower individuals to actively manage their health and well-being. Cognitive therapies are designed to help maintain cognitive function. Cognitive therapies are designed to improve cognitive function. These therapies aim to support and enhance mental processes. Cognitive therapies focus on maintaining mental clarity and cognitive abilities. Cognitive therapies can be used to promote overall cognitive well-being. Regular physical activity enhances blood flow to the brain. Improved cerebral blood flow supports cognitive health. Physical activity promotes the delivery of oxygen and nutrients to brain cells. Consistent exercise contributes to improved cognitive function and overall brain health. A diet rich in antioxidants supports brain health by combating oxidative stress. Omega-3 fatty acids are essential nutrients that promote optimal brain function and structure. Antioxidants and omega-3 fatty acids work synergistically to enhance cognitive functions and overall brain wellness. Incorporating antioxidant-rich foods and omega-3 sources into the diet provides long-term benefits for brain health. Social engagement contributes to the maintenance of cognitive function. Mental stimulation through social activities helps preserve cognitive abilities. Cognitive function is supported by active participation in social interactions. Sustained social engagement provides ongoing mental stimulation, benefiting cognitive health. Regular monitoring of cognitive function is crucial for early detection of potential issues. Cognitive assessments provide a structured method for evaluating various mental abilities. Screenings can identify individuals who may benefit from more comprehensive cognitive evaluations. Monitoring cognitive function can involve various tests, including memory and attention assessments. Consistent monitoring helps track changes in cognitive performance over time. Early detection through monitoring allows for timely intervention and management of cognitive decline. Early detection enables timely interventions for cognitive decline. Early management of cognitive decline can significantly improve patient outcomes. Timely interventions can slow the progression of cognitive impairment. Early detection supports proactive strategies in managing cognitive health. Dementia screening tools, such as the Mini Mental State Examination, MMSE, can aid in cognitive assessment. The Montreal Cognitive Assessment, MoCA, is another tool used for dementia screening. These tools help evaluate various cognitive functions to detect potential signs of dementia. The MMSE and MoCA provide structured methods for assessing cognitive abilities. Utilizing these screening tools can facilitate early detection and intervention for dementia. Caregivers should be actively involved in monitoring medication usage. Caregivers play a crucial role in observing and reporting any cognitive changes. Collaborative monitoring helps ensure medication adherence and effectiveness. Consistent monitoring allows for timely adjustments to medication or care plans. Involving caregivers enhances the overall quality of patient care and support. Providing support to caregivers is essential for managing medication-related risks. Education empowers caregivers to understand and mitigate potential medication errors. Caregiver support includes resources for recognizing and responding to adverse drug reactions. Effective support systems help caregivers navigate complex medication schedules and instructions. Caregiver education reduces medication-related hospitalizations and improves patient outcomes. Medication management strategies include using pill organizers to improve adherence. Setting reminders is another effective strategy for medication management. Pill organizers help patients visually track and manage their daily medication intake. Reminders can be set on various devices, such as smartphones or smartwatches, to ensure timely medication intake. Combining pill organizers and reminders provides a comprehensive approach to medication management. Effective medication management strategies improve health outcomes and reduce the risk of missed doses. Pill organizers are designed to help individuals take medications correctly. These organizers ensure medications are taken on time, promoting adherence to prescribed schedules. Consistent use of pill organizers can improve medication management. Pill organizers come in various forms to accommodate different medication needs. By simplifying the process, pill organizers support independent living and better health outcomes. Medication reminders enhance adherence to prescribed treatment plans. Utilizing reminders reduces the likelihood of medication errors, such as missed doses or incorrect timing. Reminder systems can be implemented through various methods, including alarms, apps, and automated notifications. Consistent use of medication reminders supports better health outcomes and improved patient well-being. Educating seniors and caregivers about medication risks is crucial for patient safety. Education programs should cover potential side effects, drug interactions, and proper dosage. Seniors and caregivers need to understand how to manage medications safely and effectively. Providing educational resources can reduce medication-related adverse events and improve health outcomes. Seniors and caregivers must be aware of potential medication side effects to ensure safety. Understanding side effects enables timely medical intervention when necessary. Promptly seeking medical attention can mitigate severe consequences of adverse drug reactions. Comprehensive knowledge of medication side effects empowers informed decision-making regarding treatment options. Caregivers play a crucial role in monitoring seniors for side effects and reporting them to healthcare providers. Access to resources on medication safety is essential for informed healthcare decisions. Websites provide comprehensive information on medication usage, side effects, and potential interactions. Support groups offer a platform for sharing experiences and receiving emotional support related to medication management. Informational brochures offer concise summaries of key medication details and safety guidelines. Utilizing medication safety resources promotes responsible medication practices and reduces potential risks. Adverse drug reactions should be reported to healthcare providers. Suspected adverse drug reactions must be reported. Regulatory agencies should also receive reports of adverse drug reactions. Reporting adverse drug reactions helps in monitoring drug safety. Reporting contributes to the identification of potential drug safety issues. Medication reconciliation should be performed during transitions of care. Medication reconciliation is crucial during hospital discharge to ensure patient safety. The process involves comparing a patient's current medication list with newly prescribed medications. This comparison helps identify and prevent potential medication errors. Accurate medication reconciliation improves patient outcomes and reduces adverse drug events. Maintaining accurate medication lists is crucial for patient safety and effective healthcare management. Up-to-date medication lists help prevent adverse drug interactions and ensure appropriate treatment decisions. Regularly updated medication lists facilitate seamless communication between healthcare providers. Accurate medication lists minimize medication errors and improve overall patient outcomes. Effective communication between healthcare providers is crucial for coordinating medication management. Improved communication ensures accurate medication reconciliation and reduces the risk of errors. Coordinated medication management enhances patient safety and improves treatment outcomes. Clear and timely communication facilitates informed decision-making and collaborative care planning. Pharmacists are essential in identifying potential drug interactions. Pharmacists play a crucial role in recognizing potential side effects of medications. Identifying drug interactions and side effects is a key responsibility of pharmacists. Pharmacists use their expertise to mitigate risks associated with medication use. Pharmacists contribute to patient safety by monitoring and managing medication-related risks. Medication reviews by pharmacists are recommended to optimize medication regimens. Optimizing medication regimens involves ensuring appropriate dosage, frequency, and duration of medication use. Pharmacist reviews can identify potential drug interactions, contraindications, and adverse effects. Medication reviews contribute to improved patient outcomes and reduced healthcare costs.